Reducing healthcare costs. Strategies for a more affordable and sustainable healthcare system.
The rising cost of healthcare is a significant concern for individuals, families, and the healthcare system as a whole. The increasing cost of healthcare can lead to financial burdens, reduced access to care, and decreased quality of life. In this article, we'll explore the factors contributing to rising healthcare costs, the impact of high healthcare costs on individuals and the healthcare system, and strategies for reducing healthcare costs. Factors contributing to rising healthcare costs. Several factors contribute to the rising cost of healthcare, including 1. Aging population. The aging population requires more healthcare services, leading to increased costs. 2. Chronic diseases. The prevalence of chronic diseases, such as diabetes and heart disease, requires ongoing care and treatment, increasing healthcare costs. 3. Technological advancements. The development and use of new medical technologies, such as diagnostic tests and treatments, can increase healthcare costs. 4.
Administrative costs. The administrative costs of healthcare, including billing and insurance claims, can contribute to rising healthcare costs.
Impact of high healthcare costs. High healthcare costs can have a significant impact on individuals, families, and the healthcare system, including 1. Financial burdens. High healthcare costs can lead to financial burdens, including debt and reduced quality of life. 2. Reduced access to care. High healthcare costs can reduce access to care, particularly for vulnerable populations, such as low-income individuals and families. 3.
Decreased quality of life. High healthcare costs can decrease quality of life, particularly for individuals with chronic diseases or disabilities.
Strategies for reducing healthcare costs. Several strategies can help reduce healthcare costs, including 1. Preventive care. Preventive care, such as routine checkups and screenings, can help prevent illnesses and reduce healthcare costs. 2. Chronic disease management. Effective management of chronic diseases, such as diabetes and heart disease, can reduce healthcare costs. 3.
Healthcare reform. Healthcare reform efforts, such as the Affordable Care Act, can help reduce healthcare costs by increasing access to care and improving the quality of care.
4. Cost-effective care. Cost-effective care, such as telemedicine and home health care, can reduce healthcare costs. Benefits of reducing healthcare costs. Reducing healthcare costs can have several benefits, including 1.
Improved quality of life. Reducing healthcare costs can improve quality of life by reducing financial burdens and increasing access to care.
2.
Increased access to care. Reducing healthcare costs can increase access to care, particularly for vulnerable populations.
3. Improved health outcomes. Reducing healthcare costs can improve health outcomes by increasing access to preventive care and chronic disease management. Common challenges in reducing healthcare costs. Several challenges can make it difficult to reduce healthcare costs, including 1. Complexity of healthcare system. The complexity of the healthcare system can make it difficult to reduce healthcare costs. 2. Limited resources. Limited resources, including funding and personnel, can make it difficult to reduce healthcare costs. 3. Resistance to change. Resistance to change, including changes in healthcare delivery and payment models, can make it difficult to reduce healthcare costs. Overcoming challenges in reducing healthcare costs. Several strategies can help overcome challenges in reducing healthcare costs, including 1. Collaboration and coordination. Collaboration and coordination among healthcare providers, payers, and policymakers can help reduce healthcare costs. 2. Innovative solutions. Innovative solutions, such as telemedicine and home healthcare, can help reduce healthcare costs. 3.
Healthcare reform. Healthcare reform efforts, such as the Affordable Care Act, can help reduce healthcare costs by increasing access to care and improving the quality of care.
Conclusion. Reducing healthcare costs is a complex issue that requires a multifaceted approach. By understanding the factors contributing to rising healthcare costs, the impact of high healthcare costs, and strategies for reducing healthcare costs, we can work towards a more affordable and sustainable healthcare system. Recommendations. If you're interested in reducing healthcare costs, here are some recommendations. 1. Stay informed. Stay informed about healthcare costs and the factors that contribute to rising costs. 2. Use preventive care. Use preventive care services, such as routine checkups and screenings, to help prevent illnesses and reduce healthcare costs. 3. Manage chronic diseases. Manage chronic diseases effectively to reduce healthcare costs. 4.
Support healthcare reform. Support healthcare reform efforts that aim to increase access to care and improve the quality of care.